Hi there, Dr. Kerry Yerkew here. I'm a chiropractor in Kelowna. Today we're going to go over low back pain. And recently we've had many patients come to the clinic with low back pain. I'm just going to describe a few conditions that we see here and how we go about treating it. Most patients come in with low back pain that's located between the spine and the sacrum, right down here. So L5 and S1. Sometimes the pain can be in the segment right above that at L4. So it could be L4, L5, or S1, but the most common is L5 and S1. And the reason is that's a transitional area where the spine ends and then the tailbone area and the hips join in. And this area is very transitional because the weight of the body goes down onto this area, transitions into the tailbone. So there's a change in the curvature and the direction of the spine in that area. This can cause strain on the joint right at the bottom and then affect the nerve flow going down the legs, a condition known as sciatica. And that's something that patients come in with quite often is a bone out of place in the lower part of their spine, putting pressure on the sciatic nerve going down the leg. Now, the other thing that causes is tension in the muscles. So when there's misalignment in the spine, especially if there's nerve pressure, it'll cause the muscles to tighten up for two reasons. One reason is when the bone's out of alignment, the muscle on one side has to shorten and on the other side it has to get stretched to accommodate for the position of the vertebrae. The second is if the nerve is getting pinched, then there's a defense mechanism where the body tightens to prevent any more pressure from developing on the nerve. So the muscles actually tighten as a defensive procedure to keep the nerve flow going through down the leg. Because if the nerve flow gets cut off, then it's going to cause some other problems. And not only does the nerve flow go down the leg, like in the case of sciatica, but that nerve flow also goes out into the organs. The bowels, the bladder, the abdominal organs from the lower part of the spine. And this can affect the sympathetic and parasympathetic. The parasympathetic being this green nerve going to the organs from the tailbone area, and the sympathetic being the yellow nerves coming from the upper lumbar, lower thoracic area. And these two nerves are very important to keep the tone of the organs and the function of the organs balanced. Now, the other thing that I wanted to show you guys is that it can take time for this to develop. So what I like to tell my patients is usually there's either an injury or there's an event where there's some pain and discomfort. Sometimes it's treated, sometimes it's not. Then there's a reoccurrence. And as the body goes through these reoccurrences, it's compensating. So it's learning how to function not in the proper position. And as time goes on, the condition can get worse. More muscle spasm, more pressure on the nerve until it's unbearable. And usually patients come in when they have severe pain and it's affecting their activities of daily living. So patients usually come in when they're down here. And if I use this chart, that's right here on the chart, right at the bottom. So as we start to treat patients, the first thing is we want to get pain relief because that's why most people come in. They just want to feel better. So with the adjustments that we do to realign the spine, the condition starts to feel better. Pressure's coming off the nerve. They're starting to feel relief. And it's not just a direct line. It's some relief and then it feels like it's coming back again. More relief, it feels like it's coming back again. So I tell patients it's like 2 steps forward, 1 step back. And as I start to work with the alignment and the balance, give them some stretches and exercises, then what will happen is we get into that corrective phase, phase 2 right here, where we're going to correct the cause of the problem so it doesn't continue to plague the person and kind of have a reoccurrence down over here. Third, we want to improve the lifestyle habits of the patient. That could include things like posture, nutrition, stress levels. All of that will be important if we're going to maintain a higher level of function up here. So we want to restore the body's function and its health back to this level, which is up here, and that takes time for the body to go through the process of retraining, realignment, and then the conditioning process to get it there. If you guys have any questions, please type them in the comments, or you can DM me. We are accepting new patients in Kelowna. We do bill directly to insurance, including ICBC, and no doctor referral is needed to come and see us. If you're not in the Kelowna area, you're looking for a chiropractor, please reach out to me. I'd be happy to help you find a chiropractor in your area. And please subscribe to this channel and like this video, because we're going to do more videos like this. We will have some seminars coming up and more long form content so that you can understand this process better. And I'll talk to you guys soon.